Eduardo Garcia. Good morning, sir.
Good morning to you, and thank you for inviting us once again.
Okay, we were going to talk about some other things, and we're going to try and get into those other things, but the pandemic just seems to not want to go away. There are some new developments. One, the president signing an executive order, or said he's going to sign it today, on eliminating immigration, at least temporarily. How does that set with you?
Well, look, we know that at least for us in our border communities, the cross-flow of individuals coming into Imperial County and to Mexicali is an economic boom, right? It's vital to our regional economy. I know that there are some exceptions to the executive order that he's putting forward that will not impact the flow of workers coming in for the agricultural industry. Details still to be hashed out. But really, it's one of those things that I think has a tremendous amount of implications on the overall economy. But look, right now, I think the most important thing is how do we make sure that individuals who are not part of the essential jobs list are able to, one, stay home in order to stay safe, and at the same time make sure if they are individuals who are in line to receive unemployment benefits that they do so. If they are individuals who qualify for small business loans, that they do so as well. And we want to be able to facilitate those efforts and make things as easy as possible for those particular folks. But look, for us in Imperial County, the last time you and I spoke, there were approximately 43 confirmed cases of COVID-19. That was on April 1st. As of yesterday at 4:30 p.m. In Imperial County, we had 195 confirmed cases, and unfortunately, the sixth reported death taking place today in Imperial County. So clearly, the problem continues to grow. In California, there's 33,000 total cases, and unfortunately 1,200 or a little over 1,200 of them have been fatal. So we clearly have a problem still before us. And if you talk to the folks in charge of our local hospitals, whether it be Pioneers or El Centro Hospital, I think they'll tell you that there's still a major concern about the spread of this virus. And it goes to my next point, the question about opening up the economy completely, I think is something that could potentially jeopardize the lives of many. So we have to be very cautious. We have to be very thoughtful as we consider opening up, the economy, business as usual, as they would say. Imperial County has done a great job. The leaders of the county, led by the CEO and the supervisors, along with the public health directors, I think have made a lot of good calls as it relates to asking folks to stay home, asking folks to cover their face, and of course, trying to facilitate the work that they do along with the state to be able to equip our locals with the appropriate PPE, the protective equipment for our professional medical, folks, and then, of course, informing and educating the general public of the dangers, but also of the things that they should be looking out for.
Now, there's a lot of sentiment around, and I was going to ask you, I think you just covered a bit of it, how you feel. How is Sacramento looking at allowing some businesses to open up?
The governor will be making some announcements this afternoon as it relates to what are going to be the guiding principles for us to feel comfortable opening up the economy. And last week I think he laid out what were 6 points, and part of the 6 points, and I'll summarize, is really making sure that our medical facilities feel like they have the capacity to take on a surge of potential COVID-19 positive cases. Right now, that is not seeming to be the case. At the same time that we have enough people tested, or at least the capacity to test more people, regardless of them being symptomatic of COVID-19 or not. And that does not also align with what the goals and objectives have been. We still don't have enough testing to be able to feel comfortable in moving in that direction. So those are two main points that I would highlights that the governor laid out. But today, specifically at his press conference at noon, he will be discussing this further. He has set up a economic task force led by, a wide array of leaders, both in government, private sector, former governors, to be able to begin outlining what an economic recovery plan looks like for the state of California. I got to say this, we've been very fortunate that we've had some very good economic times in California. GDP growth, revenues up, unemployment down, given the circumstances from a statewide perspective. But what we were able to do during these times, and I've been in the legislature for 5, now going on 6 years, we were able to put away money in our reserves. Close to $19 billion of reserves were accumulated over the course of the last several years. Thanks a lot to Jerry Brown's, fiscal prudence and the work of now this governor and the legislature. And so we've been able to use that money to be able to attack this COVID-19 pandemic that's before us. But that money will not last forever, and we will need to plan accordingly to continue to provide essential services to Californians, and how we support our counties and local jurisdictions will remain, a question at hand. Both the legislature and the governor will have to take a look at. We're leaning heavily on the federal government and the 2 now CARES packages of resources, but we're yet to see something be put forward as it relates to how we are going to be able to support our counties and our local jurisdictions to continue to provide essential services in a fiscally responsible manner. California is preparing to lay out a plan for economic recovery and how we integrate the opening up of our economies. But at this point, given the continued increase of positive cases, we saw a 4% jump as it relates to critical care admissions into the hospitals, and that's a concern as it relates to the crisis at hand.
Okay, the small businesses are that I have talked to, and I've heard from quite a few of them, are very concerned about their survivability. Is there any way? I know the federal government has a stimulus package that I don't know if it's been approved or not. Last I heard, they were still arguing to help small businesses somewhat. Is the state going to do anything, or can they do anything to help small businesses?
Yeah, I think one of the first actions that the governor took was to defer the sales tax payments for small businesses under a certain limitation of employees, under a certain limitation of revenues that are produced. I think the number was about $5 million of gross income for these businesses. And so the state also put forward a $50 million program in the interim as businesses determine whether or not they qualify for the federal program, small business programs that the federal government has put forward. And if they don't qualify for those, then the $50 million could potentially be the backup for these businesses. The federal government yesterday, at least the Senate, has moved a policy that would put forward another $400+ trillion or so, or billion, I should say, as it relates to small business support. And I think there are some criteria that have been put in place to ensure that they go towards small business support. I would encourage small businesses in Imperial County to get in touch with the Imperial Valley SBDC Small Business Assistance Program, and the number there is 760-312-9800.
And they're doing all their business by phone or online, so keep that in mind. As is everybody. If people called your office, your local office, would you feel inundated if they? Because a lot of people need help.
Not at all. We are encouraging folks to give us a call. Our number in Imperial County is 760-355-8656. The majority of cases that are coming to our office or questions are related to the unemployment application status. Once people apply at ebb.ca.gov, there is a small time period before they hear back from the agency to determine if whether or not they are going to qualify and receive their benefits. The EDD agency has ramped up to now over 1,000+ folks answering calls from 8 to 8 p.m. They've opened up some call centers to make sure that we're able to accommodate for all of the applications. I think we are now up to 2.8, 2.9 million people who have applied for these benefits, and there are a number of different programs through the unemployment system that people will be able to qualify for, including those who are independent contractors and self-proprieting owners of their businesses. That is a program that the federal government has put forward and will begin next week. And folks will see the application and the process online at ed.ca.gov. So our office is taking many of those calls and facilitating many of the other calls related to small business technical assistance and the loan program. And again, deferring a lot of those questions to our small business assistance partners there in Imperial County. And their number, again, is 760-312-9800. But we welcome the calls. We welcome the opportunity to be of help to Imperial County residents on these matters or any other matters. We've received calls related to the DMV. We've received calls related to, whether or not people need to pay their taxes. As you know, they've extended that deadline as well to June. So a lot is happening in our office. We're available from 9 to 5, Monday through Friday. And so I encourage everyone to call us if they have any questions.
Okay, and you can direct them in the right area, even if it doesn't do. Yours is pretty much all state issues, which is a lot of issues, like you just covered. But there are some federal questions. You could direct them to Juan Vargas or somebody that could address those questions.
That's correct, or we'll direct them directly to the appropriate agency, right, in order to make sure that we're more efficient with getting answers for constituents or businesses that are really in dire need of some answers, right? So we do a lot of facilitation of directing folks in the right place to make sure that they get the answers that they're looking for. Congressman's office is one place as well. Okay,
you mentioned the fact that the governor was going to talk about some issues. I think his last talk was, pretty much a pep talk, but we need those. My argument was to those who said, well, that was all flowers, and we need that. We need some positive information because it can't all be bad. So today he's going to cover some issues, some details, and I know you're close to the governor. Can you cheat and tell us what he's going to talk about?
Yeah, he's going to talk about a roadmap to opening up the economy. There's a lot of suspense and anxiety about when do we open up businesses in order to get back into a business as usual mode. And I think that numerous times that business as usual will not be business as usual. There will be modifications to how we go about doing business in California, whether it be in our restaurants or public settings, our essential services, agencies, as well as, all other businesses that you can think of. There's going to be modifications to how we go about doing our business. But I think the governor, what he wants to do is lay out the criteria in more detail for folks to get a better understanding and when we will be able to move in the direction of opening up a second and third tier of businesses here in California. But look, again, if we're seeing an increase of positive cases and resulting in the admission to hospital critical care units in numbers like I just shared. We had 43 confirmed cases April 1st. We are on the 21st now. We have 195 cases. Mindful, a handful of them have recovered. That's 59 up until today. And but look, there are a lot of tests pending for results. And with 6 deaths in Imperial County, I think people are becoming more concerned here locally that maybe the public health and well-being has to be front and center to determine, the health and well-being of our economic integration and recovery efforts. Because healthy people, I've always said, means a healthy economy. And we want to make sure that we open up at the right time. Experts from the CDC yesterday talked about a second wave of COVID-19 infections across the country. And so there's a lot of concern about some of these states that are prematurely opening up the businesses, even without meeting some of the criteria that the federal government, that the president and the administration have put forward. The issue of testing and the issue of capacity at our hospitals is two main points. I think the other points that are there and that the governor will discuss today is how we go about implementing, certain practices as it relates to the opening up of certain businesses. That's going to be the focus of his attention, and of course, many questions about transparency and how we are spending the money that the governor has been given the authority to spend as it relates to addressing this crisis that's before us.
Okay, sir. I think the message would be then that everybody wants to, but it's better to do it right.
It's better to do it right. It's better to be safe than sorry. In this particular case, I think much is being emphasized about you can only do more to be as cautious as possible, then look back and realize that you didn't do enough. And what we're talking about here is lives. We're talking about a pandemic that we still don't have a full grasp of, understanding the disease, the virus, I should say. And the fact of the matter is that it'll be a while before there's a vaccination. We still see an increase in positive testing results. And so there's a lot of concern still within the science and medical community. And I think for us in leadership roles and the folks that need to make these critical decisions, although difficult, and I've seen and I've heard the critique that's come all the way to the president, the governor, including some of the decisions that are being made by our local leaders at the county and cities. But what we're trying to do is put the public health and well-being front and center of anything else. And yes, the economy is important. Opening up our businesses is important, but doing it at the right time with all of the safeguards in place and having the medical capacity to take on a surge of positive cases at our hospitals is going to be fundamentally key. And I think that the county is doing a good job in coordination with the public health director and the local hospitals to try to get us there. And look, before we know it, there will be small businesses opening up with modifications regarding physical distancing, how we interact with one another, and we hope that at some point the entire economy is open, but not before we have a handle on this crisis that's before us that continues to escalate.
Okay, sir. I think then the only thing that's left to say is I think it'd be very important what the governor has to say this afternoon. We thank you very much for your time again. Hopefully we'll be able to bother you again in the future. And again, whenever you have something to say, give us a call.
I really appreciate the opportunity to share a few words, thoughts on what's happening at the state level. I do want to recognize some organizations in Imperial County doing amazing work and volunteering, providing their services, the American Legion, the Imperial County 4-H, Brown Bag Coalition, Manal, Imperial County, Nana's Kitchen, Molina Healthcare, Raleigh's 4-H. I mean, the list is long. The Lexico Wellness Center, the Imperial Valley Food Bank, Red Cross. I mean, the list goes on and on. These are individuals that I think are selflessly doing some amazing work, providing of their time, their energy, and their resources to support our frontline workers. Thank you to those working at our hospitals, our clinics, our first responders, of course, and all of the essential service workers, everyone from the farmers to our farm workers and the leaders that are having to make these difficult decisions during this time. And one last message is please, if you can, stay home, stay safe. It will save lives. And at the same time, we want to make sure that we're thinking about people's health and well-being before we start talking about opening up all the businesses in our region. So thank you again for the time and look forward to speaking with you again. God bless you all, and thank you again for the opportunity.
Okay, Assemblyman, stay safe.
Thank you.
Bye.
Bye-bye.